I'm sure, well, I don't know if this happens to everyone, but I've had plenty dreams when you have that dream when all your teeth are falling. Do you have that dream?
Yeah.
You've had it before? Like, I swear I had it like only a few days ago. I just remember dreaming my teeth falling out. Hi everyone, I'm Dr. Peter and I'm a dentist working at Dental Designs Clinic, and this is...
My name is Yean. I'm the dental hygienist from Dental Design.
And today we're talking about what really happens when you never really brush your teeth.
And to be honest, Dr. Peter, have you ever skipped to brush your teeth like in your daily life?
I'll say before I was a dentist and I was still in high school and university, pre-dentistry, I wasn't the greatest.
Okay.
And I would say that's probably quite common for most young people, having worked as a dentist for a number of years, seeing plenty of teenagers. And it definitely is an education thing and also a habits kind of thing. So like there's many times you'll be like, oh, I've got too many things I want to play games, or I want to watch a show, or I'm staying up just like maybe I've got exams or things like that, and you just kind of don't think about it as a student because that's just not at the forefront. And then obviously sometimes when you're in university and you've got those like big parties, you come home, it's super late, you're like, oh, I'm just gonna fall asleep.
Yeah.
So it definitely happened, but yeah, after I became a dentist, especially after I met my wife, who also is a dentist, then I got a lot better. But yes, I'll admit I have skipped sometimes. Yeah.
Okay.
How about you? Any changes?
Actually, I'm quite a disciplined person, so I never skip like for the brushing in my daily life. So I think that's like a habit like in my bloodstream.
Yeah.
So
Yeah. I think it's a big thing, habits though, because like before I started doing dentistry, I never really flossed. I wasn't a big flosser.
Me too.
Yeah, I wasn't a big flosser.
Yeah, I also don't know how to floss.
Yeah. And then I started dentistry, and then they show you all the things that's going on, and then you get paranoid. And then you start thinking about what's in your mouth when you go to sleep, and you're like, oh gosh, maybe I should start flossing.
I think like that's very common. Like most likely patients also think about that, like flossing can like damage your teeth, make your gap bigger.
I've heard that.
From my mindset from previous, like when my sister like doing like flossing at home, so like she encouraged like for me to floss. Then I say no, I'm not going to floss. Until my maybe like late 20. I just starting like to floss.
I think one of the big things for flossing, and I know we're supposed to be talking about brushing teeth, but flossing is also a very important part of oral hygiene.
Yes, correct.
Flossing is a tough one because it's a harder thing to feel the result from for some people. Like obviously when you brush, you can feel the toothpaste, you can feel the motion, but flossing is much more subtle. And so sometimes when you're doing it, you don't really think about, is it doing anything? Well, some people think it's actually doing anything. Yeah. So like I've definitely heard some people say like I flossed and then I pulled out a filling, or I flossed and then I broke a tooth. And then it's more so the idea with brushing and flossing, the more regular and the better habits you have with it, then those cavities and the fillings falling out, then they're not going to really happen just because you're keeping things so clean, right? So definitely flossing is a hard one for people to get their like not just heads around, but also kind of the manual skills to do it. Because I was definitely one of those people who stood in front of the mirror and like all my fingers in my mouth, like how do I do this? This is really hard.
How they put the floss inside.
Yeah. And I have like all 4 of my wisdom teeth. They grew out all straight, and they can be such a nightmare. And like after a while, you figure it out. Yeah, but I think if we get back to the topic of like brushing teeth, the big one for not just brushing and flossing is just habits.
Correct,
if you can build a good habit, brushing regularly morning and night, it will help to just keep things healthy. And then if it becomes part of your habits, it's just it's just your day to day. You just remember, oh, I have to do this, and then you just do it, kind of thing like that.
Yeah, and then flossing definitely can like prevent like a tooth decay. That's one of the main issue lah.
Yeah, so I guess that kind of pulls onto the topic of like what happens, I guess, like if we're not brushing, like what's the process of things that are happening.
Most likely if you're not like brushing like on your daily life or daily time, so most likely like will cause like a lot of plaque build up, then maybe like bad breath, the first thing happen, maybe slowly like gingivitis. Maybe like Dr. Peter can tell more about what is gingivitis.
Yeah, well, essentially gingivitis is it's just a term to describe when your gums get inflamed. That's basically what it means. And what's happening when you get gum inflammation is, let's say for example, you aren't brushing. You're leaving the food that you're eating day to day just to slowly build up. And that food acts as like a fuel for bacteria that lives in your mouth, and everyone has bacteria in their mouth. Unfortunately, no one has no bacteria. And to be fair, some of the bacteria is good for you as well.
Yeah, it's good and bad.
But yes, that some of the bacteria will use the food that you're not cleaning away as fuel, and it will use that to then create acids that will break down your teeth, but also that bacteria also causes an inflammatory response from your body, because it isn't something that your body should be having on it. And so what happens is that bacteria causes the gums to react to it. You get the inflammation, your gums get really red, and then bleeding. And then they bleed. And that's really typical. A lot of people will say, hey, look, when they come, and I'm sure you have it when you have your cleans, because you're doing cleans a lot. Your patients always say, "Hey, look, somewhere in my mouth it's bleeding when I brush."
Correct.
And then sometimes I'll say that I'm avoiding that area because it's bleeding. I don't want it to bleed more. And then that's the point where you're like, okay, you
should brush more on that area because it's
counterintuitive. It's like, it's something's bleeding. You don't want to irritate it. But in this situation, it's like, okay, the thing that's causing the bleeding is actually the food and the plaque. So you actually do want to brush it away. And so essentially, if we get back to the what gingivitis is, it's just inflammation of the gums. Now, the good thing about it is reversible. After you come in for your dental hygiene visit, Yean gives you a really, really spotless clean. Then usually after that, it's like you'll find that the gums just like really perk up. They get really nice and pink. Especially if they're able to keep it cleaner for longer, then it just gets really nice and healthy. Bleeding gets a lot more controlled.
Yes,
and
correct.
And to be fair, that doesn't always have to be just after you have a clean. People, if they've got good oral hygiene, they're brushing well, brushing the areas well around the gums, flossing pretty regularly as well, then you'll notice very minor bleeding.
True.
It's kind of bridging from gingivitis that we're just talking about. Another aspect of not brushing regularly is something called periodontal disease.
Yes.
Which it's a fancy term, but basically it just means bone loss around your teeth. And so teeth are supported by something called the periodontal ligament, which I don't really want to get too much detail into it, but it's just basically the supporting structure around your tooth. And it's not just the bone, it's
the gum as well.
It's the gum, it's the fibers that support the tooth within the bone. And what happens with if you're not regularly brushing is, yes, you get gum disease, and as we talked about, gum disease is reversible, but
I think the first sign for the gum disease, like periodontal disease, like what Dr. Peter mentioned about that, is about they have a very bad breath everywhere when they just open their mouth. Most likely I can sting or smell from their mouth, whoever have the periodontal disease.
Yeah, there is.
Yeah.
So, in a lot of times when we are talking about people with periodontal disease, it's usually a more severe case of patients suffering from quite poor oral hygiene, and then having this basically they've kind of passed the point of just gingivitis now. So the gums have already been very, very inflamed for a long time, and the plaque in the what we call calculus, which is like the buildup of plaque over a long period of time, is starting to not just affect the gums, it's starting to go under the gums and start affecting the bones. And unfortunately, once you reach that level, what we call periodontal disease, is not exactly, it is to a certain extent reversible, but it is much more difficult to handle than just gingivitis. And so what happens is that plaque, that bacteria causes that long-term inflammation. The bone is constantly being attacked as well, and the bone slowly recedes away from that. And as a consequence, the bone's supporting your gums, so the gums will follow it. And then that's when patients will often have those issues. And so that's a really big, that's one of the biggest problems with not brushing regularly. You're going to get that buildup of the calculus under the gums. It's going to cause a periodontal disease. And then, yes, that smell is a very typical thing that you'll find in patients that have periodontal disease. It's just because, like, if you want to think of an analogy, you're essentially leaving like imagine in Singapore you left in your sink just dirty plates. And I'm originally from New Zealand, so you could maybe do that for a day or two and it's not horrible because the weather's not hot. But if you left something out for that long, you're going to get smells, you're going to get things coming, and it's not a pleasant thing, so you want to clean it. Ideally you're probably cleaning every day just because it's so hot in Singapore. But it's the same idea with your teeth, right? If you're not keeping things healthy, keeping it clean, then you're going to run into problems.
How about like if you never treated, if you have the gum perio disease, so what's going on to your tooth? So in the really, really severe cases, and this is really, really then you've just kind of let things get quite out of control, then the bone loss gets very severe, and obviously your tooth is being supported by that bone. Yes.
And as that runs away, then that bone support is going to then reflect in mobility in your tooth. And I'm sure, well, I don't know if this happens to everyone, but I've had plenty dreams when you have that dream when all your teeth are falling. Do you have that dream?
Yeah.
You've had it before? Like, I swear I had it like only a few days ago. I just remember dreaming my teeth falling out. That's probably what like it would be like if you have periodontal disease to that level. The teeth actually get so wobbly to the extent that they will actually just fall out by themselves. And so that's a really big problem that a lot of people do suffer from, unfortunately. And that's when prevention is actually going to be the most important thing, because treatment for periodontal disease can sometimes not be the most simplest thing. It's a difficult thing to manage. So prevention, just good oral hygiene habits, brushing, twice a day, brushing well twice a day, and flossing.
And see your dentist more regularly.
Yeah, of course, definitely.
Four times a year.
So at minimum, ideally see your dentist every 6 months. If you're maybe not cleaning so well, you'll come in more regularly, just so we can help you. But by having good oral hygiene, seeing the dentist, seeing the hygienist, having those cleans just to keep things like fresh and healthy, then you're in a pretty good place. But it does unfortunately takes a bit of a commitment, not just to come to the dentist, but as we're talking about the flossing, the brushing regularly, those habits that you got to build into. But it really does pay off in the long term, as you mentioned. As you get older in life, the less issues you have with your teeth, things just get a lot easier. Unfortunately, teeth have a finite lifespan, and everything. Especially these days, everyone seems to be living a lot longer. They got to last you a long time. So the better you look after them early in life, the longer they're just going to kind of keep going. Yeah. Okay. And so, kind of thinking what else can happen when you're not brushing regularly or when you're never brushing is what happens to the aesthetics, to your teeth, in terms of your smile and things like that. And so Yean, being a hygienist, obviously sees a lot of people who have not cleaned so regularly. And so like, what do you typically think or see in terms of the aesthetics there?
Okay, mostly if you not like clean your teeth well, when you will cause more like stain. Sometimes you can see like brown stain or yellow stain, which on the outer layer of the teeth surface. So when you smile to people, it's kind of like not so nice, and also sometimes can cause bad breath, and you can see like some plaque stick on the tooth surface if you get closer to your friends, or maybe like a foot track in between when you talk to people, or like smiling. So that this kind of issue will cause like a very like a self-confident issue.
I can see there's definitely times when you're when you eat something and you get paranoid that, especially like let's say you eat chicken.
Okay.
So you feel like the chicken goes everywhere, right? And then
Okay,
and
or
then
vegetables.
but then you get really paranoid because you think when you go to talk to someone, it's like in my teeth. Like, my wife is definitely the first thing she does after we eat a meal, just stare at me and say, "Is there something in my teeth?" And then I'm like, "No." And if there is something and I miss it, big trouble. But like, yeah. But as you're mentioning, if you're regularly cleaning and you're brushing quite well, then you can manage those stains, food, plaque build up between your teeth. So generally your smile just tends to be a bit nicer. But obviously coming to see the dentist and the hygienist helps a lot as well, because when you come in, we can help you to get rid of those stains. We can help you get rid of the calculus and plaque that's blocking out the teeth and just make things look a lot nicer. So obviously we can help a lot from that aspect. But yeah, that's why brushing regularly helps just maintain a nice smile. Yeah. And then I guess the next thing, which is, I guess this is quite a big one, is what happens when you're not brushing in terms of cavities. And essentially, one of the big reasons why you're brushing and flossing well is because you're trying to stop that buildup of the plaque and the bacteria. Because as we talked about earlier, that bacteria is kind of using your food to make an acid that will then slowly break down the minerals in your teeth. And so what will slowly happen if you leave that bacteria in your mouth for too long in those locations is that it starts to damage the tooth. It pulls out the minerals of the tooth. And as the minerals come out, you start losing that, basically like the framework, the structure that's holding the tooth together in that location there. And then with time, if you leave it long enough, then you start getting those cavities. Yeah. Now, ideally, you're coming to your dentist quite regularly, or you're just coming to the hygienist so someone can spot it. Because to be honest, very, very hard to spot a cavity until it's huge. Yeah. Usually when a patient comes in and tells me I see a cavity, I already think, okay, I'm going to find a big hole. Because when a patient can see it outside their mouth and just looking in a mirror from far away, it means it's quite a big hole.
That's true.
Yeah. But if you're trying to catch a cavity in its early stages, which is really the best time to catch it, because then it's really, really minimal intervention. It's just maybe like a small filling, or even if it's not even that bad yet, maybe some prevention is like some instruction and advice will be all that's needed. But if we can catch those problems early, then we can stop them from getting worse, and we can just address them then and there. But if, let's say, for example, we really have left it to go a little bit too far, as we mentioned, to the point where the patient starts noticing the cavity themselves, that's when usually things can be more complicated, because the hole's usually quite extensive at that point. At that point, if we're a bit unlucky, the hole could be so large that then it starts affecting the underlying nerve in the middle of the tooth. And then we're talking about what we call root canal treatment, or if it's really, really bad, you've got we're talking about extractions of the teeth and things like that. So brushing and flossing well will help to prevent the dental cavities. And then even if let's say we still get the cavities, early prevention, catching the problems early, just doing like a small simple filling or just some remineralization of the area will be all that's necessary. But yeah, another pivotal point about why brushing regularly, flossing regularly is going to make your teeth healthier, your gums healthier, your smile nicer. It'll make our jobs a lot easier as well, because I'm sure Lean's seen plenty of patients when you see and you're like, okay, I've got half an hour to do a clean. And then that half an hour sometimes is perfectly more than enough time for some patients. And then you see the half an hour and you see one patient, you're like, oh, I'm going to be working super fast, or you'll be, okay, I got to do this. And then say, I'm sorry, I've got to bring you back. Because sometimes if you're not brushing too well, you got those challenges.
Maybe had to split into 2 appointments to come back.
Yeah. But what's important is that when you come to see us, we will clean everything, get it really nice and healthy, and when you leave, your gums and your teeth will be in a better place. And sometimes it might take a little bit longer. 2 appointments. Sometimes maybe the appointments might be a little bit uncomfortable because,
Yes,
you know, when you
correct.
got that calculus, it's all under the gums, you know, we have to get to it to make sure that you get off to a better place. But yeah, we try our best to make sure our patients leave with as healthy gums and teeth as possible. Branching off a little bit, still related to, you know, the not brushing regularly, that buildup of calculus and long-term inflammation of the gums. There actually has been some studies that have suggested that there's a relationship between the health of your gums and your bones around your teeth that affect different parts of your body.
Yeah, the bloodstream is everywhere.
Yeah, because your whole body is
yeah.
connected, right?
Yeah.
And like it's the same idea. If you think about it, your mouth is actually one of the most easy pathways into the human body, not just for your food, but for bacteria and things like that. And so everything else in your body is covered. You know, it's all covered by your skin, and that's it's basically an impenetrable layer that protects you. But in your mouth, it's a little bit different. And so the bacteria that's in the mouth can affect certain parts in your body. And so there's definitely been studies that have showed, for example, people who have diabetes, especially uncontrolled diabetes, they will suffer from more severe issues when it's relating to gum disease, periodontal disease. So they'll often experience more severe problems related to that. So the bone loss can be more severe. And then there's also studies that suggest there's a relationship back from the
Heart disease, is it?
Yeah, well, if we're talking about diabetes, then it actually has this association saying that people who have uncontrolled gum disease actually tend to have more severe diabetic issues. That like they have more difficulty controlling their diabetes because of it. The idea is that because diabetes is a very multifaceted condition, it's not just about your diet, your exercise. There's many things that can contribute to it. So you want to get things under control. You know, just regular brushing, flossing, seeing the dentist to help control that part. It's a small thing, but it does help in the long term with everything else. So that benefits as well. And then there have been also studies in terms of heart disease. People who tend to have uncontrolled periodontal gum disease, they have higher risk of heart disease and heart conditions. For example, like a lot of the times when we see certain patients, if they've had certain heart surgeries, heart conditions, or they've had like limbs or things replaced, we have to take extra precaution with treatment with them because as Yean mentioned, you know, your body, everything's connected in your body. Bacteria can go through your mouth, travel through the blood into the body. And so, you know, it has connections to, you know, that heart disease, diabetes, and everything else like that. So, yeah, it is important to try to control that in that aspect. I guess then you're starting to think, okay, what about the patients or the people who haven't been brushing their teeth and they feel like they've got all the issues we talked about, stains, the buildup of the calculus, the bad breath. Would you say they're like, it's too far gone, I can't come in anymore, my teeth are too ruined now? And what would you say?
Okay, just come and clean your teeth. That definitely will help a lot.
Yeah. So I think no one's a lost cause. You know, if you haven't been to the dentist 5-10 years, you come in, it's just taking one step at a time. Get your teeth really clean, get everything healthy, and we just try to get you to point A to point B. It's not too complicated. We just want to take a step at a time.
Regular routine checkup to see your dentist every twice a year is very important, or see hygienist every twice a year. That help a lot for your dental health. Yeah.
Yeah. So that's pretty much it when we're talking about, you know, not brushing. In terms of at our clinic, how we work with, we're very fortunate that we've got a really good support staff and our hygienists. We've got a lot of good equipment at our clinic,
especially like with the airflow system.
We've got really good equipment for getting rid of the stains, really good for getting a really thorough clean. And so, and all of us are really committed to making sure that our patients have come out with a really healthy, happy smile at the end of the day. So yeah, if you're one of those people who have been a bit nervous because you feel like there's a lot of things going on in your mouth, don't worry, just take a step at a time. You come see us. We mostly are very nice.
Yeah. If you have a phobia,
nice.
also okay. Yeah, just come inside and then we will guide you. Yeah.
Yeah, and at the end of the day, we're just trying to make sure that everyone can leave with a healthy smile.
Yeah.
Pretty much it in terms of the topic for not brushing. We hope you guys enjoyed listening to our talk today. Hope we didn't ramble too much. If you have any questions, any concerns, feel free to contact us at our clinic. And it's been a real pleasure talking to you guys today.
And we hope this video can help all of you to gain knowledge about brushing is very important, and see your dentist in a very routine checkup twice a year. Okay. Thank you so much. Yeah.
Thanks, guys. Bye.
Bye bye.